Namaste. Respected dignitaries, healthcare leaders, colleagues, and friends. My name is Emily Bancroft, and I'm the Chief Executive Officer of Healthcare Without Harm. I would like to express my sincere gratitude to the organizers of the H.E.L.P conference, to Yashoda Hospitals, and to all partners for bringing us together to discuss a topic that is critical for the future of healthcare, how we can build systems that protect both people and the planet. The climate crisis is a public health emergency, and health systems are at the front line. The healthcare sector is also unique. It's the one sector that has within it the commitment and the responsibility to heal and not to harm. And everything we see in research and in our lived experience reminds us that climate change is already a health emergency. Every indicator is moving faster than anticipated, and the impacts are showing up in your clinics, in your hospitals, and in your communities. And yet, the institutions created to heal us cannot continue to contribute to the environmental harms that make people sick, nor can they falter as climate-driven disasters intensify. So health systems must rapidly reduce their environmental footprint while also strengthening their ability to deliver care before, during, and after climate shocks. This idea of climate resilient healthcare, it's not optional. It is fundamental to protecting patients, safeguarding communities, and upholding the sector's healing mission. And the good news is that the healthcare sector is also a leader in developing solutions. Teams in your health systems are directly engaged in studying the impacts of rising heat-related illness, mental health of clinicians and communities based on climate impacts, worsening air quality, vector-borne diseases, the impact of plastics, and the disproportionate burden of all these things on vulnerable communities and populations. And this research aligns with what you experience daily. This idea that climate is not a distant environmental issue. It is here and it is reshaping the practice of medicine today. All of you who are attending the H.E.L.P conference are healthcare leaders and partners who are proving that the sector can and must be part of the solution. Despite shifting policy landscapes, you are all in this room driving massive change, reducing environmental impact, saving money, and improving the quality of patient care all at the same time. And what we see in India is a healthcare sector that's moving beyond doing no harm to becoming a partner in healing, healing our patients, healing our communities, and healing the environment which sustains us all. And you're learning to operate at all three of these levels and to find solutions that work for everyone, including finding ways to save money for the health system and reduce the overall costs of healthcare on people. We are all part of the first generation of health professionals and public health professionals practicing climate resilient healthcare delivery. But every generation after ours will also need to continue to adapt and innovate along these lines. You are all part of this growing movement, and you're not alone. Along with the leadership of the H.E.L.P network in India, Healthcare Without Harm has developed additional partnerships in the US, in Europe, in Latin America, Southeast Asia, and in Africa. We now have over 2,300 institutional members across 88 countries, and we collaborate with thousands of hospitals and clinicians. There are many health organizations that are now addressing climate impacts and environmental health, more now than ever before. This is progress, and India has been leading the way in helping to create this sector-wide shift. The work you'll hear about over the course of the day today is a demonstration of what is possible when health systems step forward with urgency and with innovation. And this work is not just driving change for India. India is leading the way in showing the world what climate resilient healthcare looks like in action. Leaders, policymakers, and practitioners around the world are drawing from your experiences, adapting them to their own contexts, and accelerating progress towards resilient health systems that protect both people and the planet. I want to thank the H.E.L.P Steering Committee under the leadership of Dr. Alexander Thomas. I also want to thank Professor Sanjay Zope, President of the Public Health Foundation of India, for their partnership in HELP, and Dr. Lingay from Yashoda Hospital for being such a gracious host. I wish you all impactful and productive deliberations today, and I look forward to seeing your work in action, both in India and on the global stage. Thank you.